Okay, we are live. We're gonna wait just a few minutes for people to show up, and then we'll start.
Okay, sounds good. Yeah. Welcome, everyone. We'll get started in just a few minutes. And if you want to introduce yourself, please enter your name or say hi in the chat box. Welcome, everyone. We'll get started in just a couple minutes.
Okay, it's 6:05. Let's get started. Okay, so before we get started, I'd like to thank Katie so much for bringing on Ms. Smith here tonight. She is really like the bridge that connected Alliance HOSA to Ms. Smith, so thank you, Katie. A quick shout out to her. Anyways, welcome Alliance HOSA members to our November guest speaker event. Good evening, I am Mansa Prasad, and just to introduce myself, I am the Secretary of Alliance Academies HOSA, and I am so excited to be here tonight with Ms. Smith and Aditi, and with all of you to learn more about what a flight nurse really is. So Aditi, why don't you introduce yourself?
I'm Aditi, part of the Sophomore Council, and I'm so eager to learn more about this exciting profession.
All right, I'm Bobby Smith. I'm the Operation and Flight Manager of our Labor and Delivery and Mother Newborn Unit here at St. Vincent Healthcare in Billings, Montana. So I'm really excited to be here to talk to you guys today a little bit about this profession and what we aim to do. So flight nursing really kind of evolved for rural communities because it's a way for us to be able to reach those hard to access communities. So I'm going to talk to you a little bit about my journey and how I actually became a nurse. Next slide, please. There we go. All right. So really, I grew up in a very small town in central Idaho. And by small, I mean really small, less than a population of 1,000, no stoplight even. And so for me, rural community is where everybody knew everybody and everybody helped everyone. And we took care of each other. And so I think this carries over to what you see now, where I live in a small town in Cook City, Montana, outside of Yellowstone Park. But I actually practice in a hospital a little ways from that. And I came to Montana on an athletic scholarship. And in my second year of college, this is where I remember my mom telling me I needed to pick a profession. And I wish I could tell you that I had one of those stories where I just always knew that I wanted to be a nurse. But I don't actually. And so I needed to pick a profession. And I felt like I had been good with people, and my mom and I were brainstorming, and she came up with a nurse because in the small communities that we have, I provided senior care for a lot of our community members, and we just felt like that would be the right fit. So I did. And it turned out to be the perfect fit for me. Next slide. There we go. All right, I graduated from MSU and became a public health nurse in a rural community that covered about a 200 square mile radius. And I did that for about 2 years before I took a job in Billings at St. Vincent Healthcare on the OB unit. And I actually had to trick my way into a job there. So one thing I would tell you is to have some perseverance with wherever you're seeking a job and an opportunity and a career. With a little luck and a little perseverance, you can get a job. But because I was a public health nurse, they didn't have any openings on the OB unit. A lot of times that turnover rate isn't very high. And so I got an interview by saying I was a public health nurse and wanting to learn more about their program. And then by the time I met the manager, I told her I really wanted to work there, and she interviewed me on the spot, and that is how I actually got a job on the OB unit. I've worked for St. Vincent Healthcare for 18 years and have trained in their NICU and their neonatal intensive care unit, the newborn area for all newborns, the postpartum area where you go after you have a baby, and then in the labor and delivery area. And I've managed all of those areas for the last 6.5 years. And so I also have taught for Montana State University, and you'll see this picture here. So these are some of my colleagues. And we have 5 different kind of conference places for our nursing program. So we have a home base in one town in Montana, and then there's 5 outreach clinics where we do nursing and have the nursing programs. And so because we're rural, we have to really try to get clinical sites for our nurses, and this is how we do it. And so I teach for MSU and have taught for them for 18 years as well as manage one of the units. We can go to the next slide. So this is a really interesting slide. So when I go back and look at my career over time, I actually worked as a National Heliattack member on a crew. And so it fit really well with where I actually have ended up in my nursing career. And so this actually was my dream job. And I probably would have stayed doing it. However, it was seasonal work. And again, my mother was, you know, a practical thinker. So off to college, I went to actually have a career that was not seasonal. Little did I know that this job would actually prepare me for what I was going to do in managing later in my career with the flight team. And so I remember the first time I made a lead crew boss of the 25-person team. And it was there that I started to develop my leadership skills and my passion for driving a team to be their best. And that has now carried over into our flight team. And you can see here, so we rappel out of the helicopters. We do a lot of work with the helicopters. And now with our flight teams, we do that as well and do a lot of training. And some of you may have a lot of questions around that. We can go to the next slide. This is our helicopter that actually we use here at St. Vincent Healthcare. We have two of them and we rotate them out, but this helicopter actually lands right above me. And we have an adult team that can do adult flight. We have a neonatal flight team that can fly for our babies. And we have an OB flight team that does for pregnant women in what we do. And so we have not only the helicopter, but we have what we call a fixed wing. That actually is home based at the airport, and we can use either of those, and the flight teams go through certain training sessions. We have what we call a safety stand down day, where we will actually take everything out of service and talk about safety and all of the things that we do. Each day, our flight members will do a safety screening to make sure that they feel that they're safe to fly. Whether they've worked too much or if there's personal things going on, sometimes they might not feel safe to fly, and somebody else will cover for them. But it really is a robust program that we have, and we cover all from Montana, North Dakota, Wyoming. So we go to trauma calls and car accidents. We can go if there's rural critical care access hospitals or small facilities. They can stabilize the patient and then we go and get them. And we truly can cover about a 700-mile radius in what we do. The state's actually very big, and that's where we'll also service the multi-state areas. Next slide. So to finish up, really, I think before we enter into where you ask questions about what we do, I would say you need to love what you do. Between managing, nursing, and teaching, I have filled all of my passions and love what I do. And I want to encourage all of you to find the right fit for what you want to do. As you know, we're talking about healthcare professionals. There's a niche for everybody. So nursing really is great. And I tell my students this all the time. Whether it's pediatrics, whether it's adult, whether it's hospice, there's so many different avenues that you can go just with nursing care. And I have got to do about 3 different ones, and I'm currently doing 3 or 4 different things with nursing that all are different, but they're the same, and they still have, they give me satisfaction. And I would say, love what you do, and you'll find purpose and meaning in your life. And I didn't even know that I really wanted to be an OB nurse. I went into nursing and I knew I loved nursing, but until I had my clinical rotation up on the unit, I didn't know that that's where I wanted to be. And as soon as I was there, I knew it. And so as you go out and you look at what career you want in healthcare, to dabble a little bit in different things is good, because you can see really where you'll find your niche and what your passion is. I'm ready for questions if you guys want to give any.
So we can open up the chat box now for any questions at all. Aditi and I ourselves have a few questions, so we can start off with that. If you guys are feeling a little shy, that is totally okay. So look, can I start, Aditi? Is that okay with you?
Yeah.
Okay. So could you tell us what is the scariest thing that happens when you are flight nursing? What is a thing that most flight nurses are scared of messing up?
So really that you know, sometimes you want to make sure your patient's stable before you put them on the plane, and are, you know, sometimes it can be an hour and a half flight. Sometimes you don't have the option to stabilize completely, but our biggest fear as an OB nurse is that we're having a baby in the air. We don't want to have a baby in the air, right? So I can speak from an OB perspective on the flight and say we don't want to have a baby in the air, so you want to make sure your patients are safe. I know because I'm very close with a lot of the adult flight team members also, is that you're going to lose your patient in the air before you get to where you want to be. And so skill sets and knowing the steps that you need to take are really important for them. So that's why we practice drills all the time. Because then it just comes secondhand nature, because you don't want to have a moment where you can't think about what to do.
Right.
Yeah, that's definitely really interesting. Before we go on to Isabella's question, I have a question for you. How has COVID really affected what you do?
Oh, that is such a loaded question. It's affected it in a lot of ways. I think for me, the biggest piece is being able to touch my patients and being able to, you have a mask on and you're covered in PPE, and it's really challenging to make that connection with our patients. And as a nurse, that's what we want to do, right? We want to comfort our patients. We want to connect with them and the families. And so I think it's been challenging to have to limit families to not be able to be with their loved ones. And that has really affected it. And I think not trying to figure out, and I'm going to say we are figuring out different ways to connect with our patients because we have to. It's not an option to not. It's just been a little bit of a challenge to try to figure out how to do that. Does that make sense? What is the most common misconception about what you do? Oh, for an OB nurse, it's that we just get to hold babies and love on them all day. So I wish that that's what we got to do, but for me, that would be the biggest misconception is getting to hold babies all day long in the obstetric area, because we don't get to very often anymore. We're too busy.
There's so much more than just that, right?
Right. Yes. Yeah. So, and actually it was our volunteers that used to come and hold the babies. Now I once in a while will bring a baby. If I know the baby, I'll bring it down to my office and hold it. So it's fun.
Okay, we have a question from Arushi.
What is my average work week? So I'll give you a couple different perspectives so that, so as a manager, my work week is 7 days a week, 24/7. Kind of on call. Like we're short staffed. I had a bunch of staff go out today with COVID, and so I'll be on call tonight and probably be working part of tonight. And so my average work week is 24/7. For a nurse, one of my staff nurses, they do 3 12-hour shifts. They can do day or night, and so they do 7 a.m. to 7 p.m. or 7 p.m. to 7 a.m. And they'll do 3 of those a week. Now, that's a full-time nurse. A part-time nurse can do 2 12-hour shifts a week, and those can be random. So one of the things you have to remember if you're working in an acute care facility is that it's 24/7 business. So it's nights, weekends, and holidays. And so we try to come up with a fair way to rotate through the scheduling process so that everybody can have holidays off or certain weekends off. And we let our night shift people sign up first, because when they're working nights, it's really hard if they have to work one on, one off, one on, so that they can try to sleep. So depending on where you work, for us, that's our average work week. These nurses also take call, and especially in the specialized areas, ICU, emergency department, and labor and delivery that are specialized, take call, because if all of a sudden you have a high peak census, then you need to be able to bring people in to help take care of them. And so also in conjunction with their 3 shifts a week, they take a couple call shifts a month to help cover that.
Okay, going back to the question, last question, what do you say is your exact role on the team?
As their leader and manager?
Mm-hmm.
As their leader and manager, I kind of keep the chaos to a dull roar, okay? I manage all the personnel things, all of the schedules. The schedule is my ultimate responsibility. Supplies are my responsibility and to meet budget, but I also need to make sure that my staff have what they need. to do their job. So we've talked about this a lot because I actually came from the staff that I'm now managing, in that my responsibility now is not to staff the unit and work there, and I help in high census times, but my job is to make sure that they have all of the environment, the personnel, and the equipment that they need to do the care. Though I will step in and help when it's busy, which is still fun. Does that answer your question a little bit?
Yeah. Okay, so we have a question from one of our members, Sai. What are some of the hardest things to do while you transport someone?
Try to keep them calm and let them know that it's okay. You know, if somebody's being life flighted, it is a dire situation, and it's usually an emergent situation. Otherwise, they'd be coming by private car or ambulance. And so that's really a scary situation. Sometimes in non-COVID times, we've been able to transport a family member with them, depending. So you have to take into consideration, you know, your flight weights and fuel when you do those things with the helicopters and the fixed wings. So you have calculations that you have to do to make sure that you can make weight. And if you can bring a family member on with you, depending, and that sometimes helps. But I would say the hardest thing is to try to keep them calm and let them know what to expect. Because if you're the only flight nurse on there, you're trying to deal with the emotional things of your patient, but you're also trying to critically think through what you need to do to be making sure that they're medically stable and stay that way until you get them where you're taking them to. So trying to juggle and manage the emotional, yet the kind of nursing things that you have to do is a juggle.
Our next question is from our own Katie. She said, what is the best part about your job?
Oh, it's twofold. As a leader, it's my staff. The best part about them, they can be the most challenging sometimes, but the best part is my staff. I have 85 people now working under me, and I have an ultimate responsibility to them, but I love them and they love me back, and that is good. And when I go home at the end of the day, if I've done a good job for them, that is totally worth it. From a nursing perspective, it's my patients making a difference. One of the things that I actually, when I teach, I tell my senior nursing students to do is get a journal and write down some of those special moments when they have either been impacted by a patient or they have impacted somebody and know it. And it's cool to keep a journal like that, and 20 years later go back and read it and really see where you've made that difference and be reminded of that. But it's always about the patients. And I think for you guys that are going into the healthcare profession, you'll learn that there is nothing better than knowing that you helped somebody or made a difference in somebody's life. And it could be something really small. It could be, sometimes I'll just go in and hold a patient's hand. You don't even have to say anything, but just to sit with them and be with them and comfort them. That's the best part about being a nurse, is the ability to do that. Now, as a labor nurse, it's bringing a new life into the world. So it could be three different fold. And I think, again, that's what's exciting about healthcare and nursing, because I love bringing babies into the world. Going in, I'll be sitting in here, and if they need help in a delivery, because I'm right on the unit, I'll go out. I just helped with the delivery a couple days ago and went in and got to do it. And that is so fun. I love it.
Okay, we have a question up here from Jay. Since Montana is such a large state, how many divisions are there for flight nursing?
Let's see. 2, 3. There's 4 different ones. And so we'll cover for each other. And so if we're really busy on our unit or our adult team is out, they'll call another flight team and see if they can go. So that's why our radius is so big. So I think like yesterday, we had to actually go to a different, facility, pick up a patient because the flight team wasn't available, and then take them where they needed to go. And so that makes it why we have to cover such a big area, is because we can cover for each other. So that's really nice for the flight teams to be able to do that for each other as well. And so each of the flight programs have what we call a communication center or a comm center. So the calls go into that comm center, and then from the comm center, they'll see who we have available and what we have available, and then they'll disperse and dispatch through there. And so when you actually get in flight, you check in with the comm center, and that's who talks to your physician. So you kind of have a three-way phone calling system. And then when you land, you call the comm center, you assess your patients, and you do what you need to do. You stabilize them. And usually you have to take an ambulance back to wherever the plane is, if the helicopter, and because a lot of places aren't set up for helicopters to land right there. So there's ambulances that transport in between. And then you let them know when you're back in flight, and then they call where you're going to be landing and let them know when to expect you.
It's like everyone has each other's backs too, so that's great.
Yeah, it is. It's a huge team approach for sure.
Okay, so our next question is, what are the biggest risks in your job?
I'm going to take this as a flight one, and it would be, and our nurses get hazard pay when they fly. And so it would be actually taking flight. And so in Montana, weather is a huge thing. So on the fixed wing plane that we have, we actually had to get a plane that has on the front of the wings, there's like balloons that will blow up because you get ice buildup. And so when you get ice buildup, it'll weigh your plane down. And so the pilot you can actually hear it when you're sitting in the back. You'll hear them blow up, and it breaks the ice off, and you kind of hear it break off. But I would say actually flying in the weather is big. For the helicopter, it's different because we'll land on scene sometimes. And so when you land on scene, there's a lot of things that go into play to make sure that it's like what we call a landing zone or an LZ. And that landing zone has to be big enough and clear enough for the helicopter to land. And so you've got telephone wires. Those are the biggest. Wires are a big hazard for landing, to make sure that they're safe, and debris. Because when you land, if there's debris around there, it'll suck it up into the rotors and can crash you. So that's probably the biggest risk, is the flying piece and making sure where you're going, because you don't actually know where you're going.
Nandita asks, what is the hardest part of your job? So we talked about the biggest risk, and now what's the hardest part?
So for me, I would say anybody that's a flight nurse, the risk is not the hardest part. You just know that going in that's what you do. So I would say that's not the hardest part. The hardest part probably as a nurse would be when you lose a patient. And you can always do the woulda, shoulda, coulda, or the hindsights. And really trying to then message that to the family. Sometimes I would say that that's one of the hardest things, at least for me in my job, is the loss that we experience, because we don't like to lose patients.
Yeah, that's definitely something that you have to learn to deal with. And it's hard, but I think that's a big part of being a good medical professional.
Right.
And on to our next question. What are some characteristics or traits that would attribute to being a great flight nurse?
Critical thinking and fast thinking on your feet. Number one, because the situation is never the same. And so that by repetition and learning some of those things, and even the algorithms and the medication algorithms that you go through. So being able to do that, but then kind of be innovative if things veer off of the path. So I would say being able to think quick on your feet, also being able to compartmentalize and not be emotional, which can be hard, but you can't be in those situations as a flight nurse and be emotionally driven, because then it clouds your judgment and it clouds your thinking. And so you really have to be able to compartmentalize that and go through those critical thinking steps that you have to do. And you also have to make sure that you can communicate and you're a team player, because it's typically not just you out there. You're with, a lot of times flight teams are consistent of a flight nurse and a paramedic that would go with you. So it's important that you can communicate those things to your team and work together.
Our next question is pretty long. While answering a previous question, you mentioned told your staff members to keep a journal of moments that impacted them. So do you have any moments like that that made a difference for you? Oh, that's a good question.
Oh, that's a that's a really good question. I do have a couple moments that I feel like I've made a difference. So I'm on a board for the state of Montana where we raise money to pay for funeral costs for families and bereavements of any child below 1 that has passed away. And so for me, some of those special moments where as an OB nurse, people are planning on having a baby and they're not planning on paying for funeral costs. And so when we've had some of our family losses come in, to be able to go in and tell them not to have to worry about any of that and to just sit with them and be with them and start that grief process with them it's an unbelievably emotional but special time. And they're vulnerable, I think, at that state. And I love that. So that's on the loss side of things. I also have about, I think the last count I had was 18 staff members that I've got to be in on their deliveries and help deliver their babies. And that has made a difference for me. And I love it. And I get to see and watch them grow. And they all have been special moments for me that I can remember each one of those births and how neat it was. And got to give the first bath to some of them. Actually, I was just talking with one of them. He turned 17 the other day and I gave him his first bath. So that's really fun. So there's all sorts of special moments like that. But sometimes you forget it, which is why I say journal it, because then it's kind of like photo albums and you go back and you're like, oh yeah, that's right. So that was a great question.
Yeah.
A question from Sakshi. What are some of the long-term effects in nursing due to COVID-19, especially for future nursing students?
So long-term effects in nursing so that's almost a twofold question. I'm going to answer the first part in the long-term effects of nursing due to COVID. I don't think we know them yet. I think we're going to just start to see them, and it's on the spectrum of, we've been talking with like our NICU nurses and our pediatric nurses, and they're worried because when you have kids that have been in there for months in the hospital and are sick and going through treatment, this is what they see. They see somebody in a mask. They don't see any, for cognitive development, they haven't seen mouth movements. They don't see smiles. They don't get kisses. They don't get hugs. And I even miss that. I miss hugging my staff and doing different things. And so I think there's long-term effects in that piece and how we're caring for patients. And I worry that we're going to lose that compassion piece of things. And then on the other spectrum of things, because I teach community health for the nursing program, our elderly people and the effects and are what is happening to them, that they have actually been unable to have family members with them for 9 months we've been going on this. And when you talk about quality of life and the will to live, if they can't see their family members and they can't touch them and hug them and love them, what's the point? And so I think there's a huge impact that way in how that is going to impact nursing and what we do with that. That's not to say we can't think about outside the box things to do, but that has been a challenge. And I think for nursing students, and I can speak pretty closely to this, actually right before I got on with you guys, I finished with my last group, and we talked about palliative care and palliative care in those end-of-life situations, and it was a really powerful time. But I think for nursing students, I've tried to tell them it's going to be okay. I think, what we don't want to see is people scared to go into the nursing profession or healthcare profession because of COVID. What we want and what I want the message to be is that now's the time you want to do it, because you can really make a difference. And don't be scared to go into that. It's an added challenge for student nurses, but it's totally doable and manageable. It just has made it a little bit more difficult. But actually, every place that I've talked to, and I actually was just on a big conference, and one of the questions was, what are we doing with nursing students? Everybody's taking them because we need nursing students and we need them to graduate so that we can grow our nursing profession, right? You got to have nurses to take care of the patients. And so I think we're going to see even more people or universities and, embrace taking on nurses and nursing students so that we can grow that profession more. Does that answer the question?
I think so. Okay, Emily O'Donnell says, who flies the planes? I think she meant helicopters. Who flies the helicopters? Is it a nurse with a piloting license or a private pilot?
Most places have a private pilot, and depending on the facility you're at, it's really expensive to have a helicopter, the maintenance that goes with it, and the airplanes, and then the pilots that go with it. And the pilots, there's federal aviation rules that they have to follow. So most facilities will contract that out. So ours is contracted out. So we contract with a company, and they supply the planes and helicopters and the maintenance on them and the pilots. And the pilots really, from our standpoint, shouldn't know what's going on because we don't want it to influence what they're doing. We don't want them to try to fly faster and lower because the patient's critical. And so we really try to keep them out of the healthcare piece. All they do is fly. And they'll swap out, they have their safety checks. And part of the challenge in rural Montana is they can time out. And so they only have, it's kind of like truckers. They only have a certain amount of time that they can fly. So if you're flying somewhere and you're going to time out, you're stuck there until they can time back in and fly you home. And so that goes into sometimes when we get a call for a flight, we might have a pilot who's just about ready to time out. But another area would have a pilot who just came on and is good to go. So we'll have them go get the patient and even bring them to us. So they'll bring them to whatever facility the patient wants to go to. Even in the big state of Montana or Wyoming or North Dakota, based on where they want to go. But we take that into consideration.
Our next question from Grace. What did you major in college before becoming a flight nurse?
That's a great question. So I actually have one class left to have a health promotion degree. And so I was actually waiting. Nursing is pretty competitive. And I was on a wait list actually to get in. And so I was waiting and waiting and waiting to get in. And because I was on an athletic scholarship, I took other classes and started on a health promotion degree that I felt would work towards my community health area and interest. And so that was what I was majoring in before I took nursing and then did flight nursing. And flight nurses, I'll just add in there, typically when you graduate from nursing school, you have to work for a while in whatever area you're going to be before you can become a flight nurse. And so typically the way it goes is you graduate from nursing school and you get a job in an area where you work, med-surg, OB, or whatever. And then from there, once you get enough experience and get specialized, then you can become a flight nurse. And that works the same for the adult team. So typically you'll go work in a med floor, then you'll go to the emergency room or the ICU and get some critical care, and then work your way and apply for a flight nurse position. And they're pretty coveted positions and hard to get. There's not a lot of turnover in those positions.
Our next question from Aryan. What was the most interesting experience you've had so far as a flight nurse?
Most interesting. I would say doing multiples for an OB nurse, doing multiple pregnancy and hoping she wasn't going to deliver twins in the air when I came back.
Oh, wow.
Right? One baby would be good enough. Two is not good. So I would say that's probably my most interesting. And also, you want to make sure of yourself before you put them on the plane. So one of the differences, and I had talked to Katie about this, is we don't put a lot of pregnant people on the helicopter, simply because the helicopter, if you looked at it physically, the patient's feet are actually going into the tail of the helicopter. And so for a labor patient, if you had to deliver a baby, you'd have to crawl back to the tail of the helicopter, which shifts your weight. And you don't want to do that. And so you really don't want to put a labor patient on the helicopters. We'll do fixed. We have put labor patients on the helicopter if it's blood pressure, seizure, or it's a trauma in a car accident or something like that. Then we'll put them on the helicopter. But otherwise, for the most part, OB does the fixed wing. What is the pinwheel? So Katie's mom actually has a company called Sonova, which is for nursing leadership. And I drank the Kool-Aid of Sonova, and I'm a huge Sonova promoter for leadership. And so the pinwheel, actually, I got at a conference last year that I went to. And so I love that. And actually, that's the conference we were just at, so that I have been attending with Katie's mom. So go Sonova, that's the pinwheel.
Okay, Charishma asks, how did you know that nursing was the job meant for you? What are some difficulties that you faced before finding the right job? Quote unquote, the right job, yeah.
So I think I talked about this a little bit, that I didn't know nursing was the right one for me. You hear about people having that passion, and, they knew from the time that they were 2 years old that they wanted to be a nurse. And that wasn't me. And I thought, gosh, what is wrong with me? And maybe I wasn't meant to be, but that's not true. And I would say I knew that nursing was the job for me when I did my clinical rotation on OB and fell in love with it. And that's why I say dabble in a lot of different things and see where the right fit for you is. And it might not be just nursing, but there's a lot of healthcare professions out there. But figure out where you want to be and where your passion is. I knew instantly on my first day of my clinical rotation that this is where I wanted to be, and I loved it. Now, I love community health. I teach it. I worked it for a while, and I'm from a rural community. And so that, for me, by doing teaching, managing the labor and delivery unit, and now actually doing Sonova things, I am doing everything that I want to do with my profession. And it just keeps growing, and it keeps filling my cup more all the time, and it's not a stagnant thing. So nursing's ever changing, and that's exciting to me. Some of the difficulties I faced before finding my right job, I would say it was probably because I loved firefighting, and that's what I wanted to do, but it wasn't fitting because it was seasonal at the time. And being female, it wasn't 20 years ago really a place where you could go. And so I had to pick something else. And so I just had that difficulty in kind of wading through the water, hoping that I was going to find the right thing. And, everybody that I was in nursing school with they knew that they wanted to be a nurse. And so it just took me a little bit of time to find my niche.
From Sonia, how do you handle the stress of your career?
I'm still figuring that out.
Right.
I'm not sure. I would have said I had a really good answer until this year. This year has added a little bit of a level of stress that even today, I thought I had the week pretty handled for a Tuesday, and it got a little bit more stressful today. Trying to find time for myself. And actually at one of the conferences for Sonova, finding a time for 30 minutes where I can just have quiet and really put myself together. And I work out, I fish. Anybody in Montana, you got to fish, right? In Montana, that's a must. So I fish and try to get some time for myself with my family. You gotta make that break. So for me as a leader in the management position, because I said it was 24/7, that's hard to do. And so I actually have 2 people on my team that will cover call for me so that I can take a break. I don't do it very often, but they will cover for me so that I can have a break.
Okay. Surya says, what was an example of barrier you had to overcome to accomplish a certain task?
So actually, I just did a talk yesterday on this. And, you know, I'm one of those, I don't like to be told no. So if somebody tells me I can't do something, I'll figure out a way to do it. And so we have a underserved Native American population. And sometimes those women have to come 200 miles for prenatal care and don't have the transportation to do it. And so we figured out a way to take our midwifery services out there to help do a clinic out on the reservation so that those women could get care. And it was a year-long process to try to get all of the pieces and parts to work. But it was a barrier that we had to overcome, but we have seen such tremendous positive outcomes and women being able to come and get the care that they needed. And it's just exciting. It was exciting work that we partnered with our midwives to do. These are all really good questions.
Yeah, definitely. Okay, so I have a question. So nursing school is obviously like challenging. What was your motivation in getting through college and nursing school?
To keep it going.
Because I didn't want to face the wrath of my mom if I didn't. No, I'm teasing. The motivation was because once I figured out where I wanted to be, it was that drive to develop my own practice. Each nurse can develop their own practice and you have some autonomy to do that. And I think that it was that drive, and there were ways that I wanted to be able to provide care for my patients. So you have to get through school in order to do that. But I enjoyed school as I was going through. I have lifelong friends that I went through nursing school with, and we still talk. And it made some great relationships and had fun going through nursing school that way. But it was the ultimate goal of wanting to be able to take care of my patients the way I wanted to that drove me to do that. Plus, I needed money. I was broke.
Oh, we have a question from Anurag. What are the certifications that you need to be a flight nurse, and is it a relatively dangerous job?
So depending on which area you're going to be in. If you're in the adult flight world, you have to have special certifications we call ACLS, which is like your cardiac rhythms and being able to give cardiac meds and defibrillate people and stuff like that. So you have to have those certifications. You have to have intubation skills to be able to intubate somebody. And for our pediatric certifications, it comes with the same, only it's in the pediatric world. And then for our baby world, we have our neonatal resuscitation certifications that you have to have in order to be a flight nurse for the neonatal. And you have to be able to do umbilical lines and art lines on those babies. And for the OB world, you have to be able to read fetal monitor strips and go through all of the, with OB patients, you have 2 patients. You have baby and a mom. So you've got to be able to take care of both of them, and they come with certifications for that. Do I think it's a relatively dangerous job? No. Well, yes and no. We have lost a flight. We had probably about 22 years ago, we had a team go down here that we lost everybody on board. So I think there's more danger in the helicopter than there is the fixed wing, depending on the weather conditions. But it can be a little bit dangerous. I have some nurses who would love to be a flight nurse, but won't do it because their family doesn't want them to.
Now, most of our audience here tonight are high schoolers. So do you have any recommendations for high schoolers who want to take on nursing? Any tips? Yeah.
Nursing school is a little bit competitive. So I would say if you guys can do any sorts of community service in a lot of nursing programs they're kind of like bonus points, right? And it shows how you want to serve communities and people. So community service is a huge proponent of anything like that. Some hospitals have programs where students can volunteer and do volunteer services, kind of like the candy striper of the old day. And now COVID has changed that a little bit, but I think being able to do those types of things or work as a certified nurse's assistant and get your certification helps you know where you want to be. It gives you those doors. You can work at our assisted living care facilities and see what that area is like. So there's a lot of different avenues where you can work as certified nurses assistants or volunteers that would be really good and give you good experience to make sure it's what you want to do.
Okay.
Yes, that's definitely really good advice. Thank you for sharing that. And we have a question from Jay. Obviously, ambulances are the most common form of transportation medical-wise. How do patients or their family members react when they see a helicopter?
I think for a life flight situation, and I can speak from it personally from when I was little, it's scary. And so your patient's scared and the family members are scared. And when you go and pick up a patient and you're leaving the whole family there. So we really try to at least bring one family member if we can for that. And sometimes depending where the helicopter can land or if it's the fixed wing, sometimes the ambulance actually we have to have an ambulance take it while we're going to land. Unless it's a vehicle accident, a lot of times the ambulances have to transport the patient somewhere, so we don't have the family members right there all the time.
Okay.
I love helicopters though. That's my favorite.
Okay, so I have another question. I'm not exactly sure how this works, but how do you deal with patients who have like motion sickness or something like that?
Let's say that one more time.
Like, I'm not sure how this works, but how do you deal with patients who have motion sickness?
That's a good question. They get sick. So, we try to give them medications in flight to help with that, and they work fairly quickly if we can give them IV. But, when you put the patient in, whether it's the helicopter or the fixed wing, we make it so we can position them to be able to puke so that they don't aspirate it. But they will get sick sometimes. And we have some flight nurses that actually get sick sometimes. And depending, I am not one of them, but we can have a lot of turbulence and a lot of bumpy rides. And so depending on that, even our flight nurses can get sick. Because it's a pretty small plane, that we use, and the helicopter, the plane probably gets people more sick than the helicopter.
Excellent. Okay, so Sakshi asked one last question. This is our last question for the night. If I hopefully one day visit Montana, what's one place I should visit?
Yellowstone National Park. Right?
Yeah. It's beautiful.
I have an easy button, and that was the easiest question of the night. Like, easy.
Great. So again, thank you so much, Smith, for your time. You definitely inspired a lot of students to pursue medicine and healthcare. To close out our event, we'd like to thank you all for joining in tonight for this conversation and making it interactive and typing in some comments and questions. We're going to leave a QR code up on the screen for about a minute or so. You guys can scan the QR code, get attendance credits, and this video will be posted soon on our YouTube channel. So thank you guys and have a great night.
Thank you.
Thank you.